Hello, everyone, and welcome to our session today. Thank you for joining us for an interesting discussion about cultural intelligence and effective healthcare teams. A few housekeeping items before we get into our discussion today. You will note that all participants are muted with cameras off. However, there is chat functionality in Zoom, and we do encourage you to utilize that throughout our discussion today. Feel free to comment and ask questions, and note that we will save 10 to 15 minutes at the end of today's webinar for questions from the audience. For any individual who's unable to attend today, we are going to share a recording of the session that you'll be able to access. I'd like to take a moment to introduce our session administrator, Ms. Prudence Anglem. Prudence will help make sure that the session runs smoothly today. And if you have any questions, concerns, or even technical challenges, please reach out to Prudence. And you can note that her name will include session administrator in the title. Now I'd like to introduce our panelist today, Ms. Jessica Franz. Jess is an experienced healthcare professional who holds several degrees in nursing and nursing education. She's worked in social services, nursing, quality, faith-based, and higher education contexts. Her work with people from a wide range of backgrounds has helped to fuel her passion for equity. And in her current role as healthcare quality professional, Jess uses this motivation for equity to really drive change and performance improvement to ensure patients have access to high quality care. With that, Jess, let's go ahead and get into our first question of the day, okay? In your experience, what are some of the biggest challenges for healthcare teams today?
So I think when we think about today, as compared to honestly pre-pandemic, what we're seeing now is so different than what we saw in 2019, for example. There have been so many changes that came as a result of the pandemic. The pandemic was hard. It was stressful. So it took a toll on a lot of our healthcare teams, and we saw a lot of turnover, especially within nurses. We saw a really high turnover as compared to healthcare systems overall, but we saw turnover in every aspect of healthcare. So when your workforce is turning over so quickly, it's really hard to kind of keep that team together. You know, even in my own organization, we never used contract labor. It was so rare that we used contract labor. And then in 2021, we had to. Even, you know, there's times we even had up to 50% of our workforce was contract labor, which is significant. So when you're changing that team so frequently, and it's, you know, a contract is usually 12 to 13 weeks. So that contractor stays there for 12 to 13 weeks, and you have a really short time to get them up to speed with the rest of your team. But when the other half of your team has also turned over, how do you get those team members to really function as a high performing team within that environment? And it's really tricky. And I know that we're seeing this across the US. You know, my healthcare system isn't unique, and the challenges that we're seeing this across the US, that turnover, we're trying to bring it down and trying to get it in line and reduce our contract labor. And it's been a challenge. That's been the real challenge that has changed significantly in the last couple years. You know, and then you also have the, so to speak, moral hazard that occurred as a result of the pandemic. And how do we support our professionals that went through this and sometimes traumatic experience for some people? You know, I was still on the floor in 2020 as a resource nurse and nursing supervisor frequently on our COVID units. And that was the first time in my life I could actually understand what PTSD might be like. First time in my life I'd go to work and be scared that I'm going to bring something home that might kill myself or my family, because we had so little understanding early on. And so that stress just takes a toll on your workforce. And I have to believe that's part of the turnover, people just needing something different, change of scenery, change of environment, etc. But it makes it really hard for our teams then to come together and be high performing teams able to really take care of patients well.
Right, right. That's really interesting. And then you add the layer on top of that of virtual visits, right? And so there's so many examples of things that have really shifted in the healthcare industry just as a result of the changes brought with the pandemic. I'd like to ask you, Jess, what is it that you think is really causing some of these challenges? You know, this idea that there's high stakes, it's high anxiety, there's a limited amount of time. Can you talk to us a little bit about what's at the underlying foundation of the challenges you're talking about?
Yeah, so when you think about this idea and concept and philosophy of how we even form a high functioning team, like if we go back to Tuckman's concept of forming, storming, norming, and performing, and those whole steps that a team has to go through to become a high performing team, when your team is constantly changing and you're constantly adding a new member, it's really hard to get to that performing stage because you're constantly forming, you're constantly adding new people. And when your core group, so that 50%, that's your core group, is also new, and they're still learning the culture, they're still learning the policies, the procedures, all of those technical things, but most importantly, the culture, it's really hard then to bring that contract labor in every 12 weeks when we have some new contractors. It's hard to bring them into that culture and get them up to speed quickly because your core group is still learning how to perform. Before the pandemic, it used to be that our teams, it was not uncommon. We still had turnover, but you had your core group. So you'd add a new person here and there, and the culture was established. Yeah. Your team knew how to perform, so you just pull that new person in pretty quickly. But now the whole team is learning how to work together and how to work together well, and it's challenging.
Yeah, with limited time, it's almost like this idea that we're building the plane as we're flying the plane, right? We not only have to create these shared norms and get to know each other, but we have to do that in a high stakes environment. Talk to me a little bit about, your experience or what you've observed. How do people feel in these situations? You talked a little bit about PTSD. Can you just put us in the mindset of a healthcare professional who is in a team that's constantly turning over and it's very difficult to create those shared norms? What does that feel like?
So I want to pull it back to a little bit about, we do surveys in the hospital. It's culture surveys, essentially. Yeah. And one of the questions that is kind of a big marker of how well your teams are doing, essentially, is this question of, do you have a friend at work? If your team answers yes, they have a friend at work, they're more likely to be happy and satisfied and engaged. And when you don't have, this regular set of people that you get to know and you work with frequently, it's hard to develop those relationships. And it's hard to get to a place that you do understand each other and you can relate to each other and you can work well together. And so when you don't know your teammates, and healthcare is hard, it's constantly changing. You have different needs, patients, like if you're in a hospital setting, for example, which is where the majority of my experience is. So if you're in a hospital setting and one of your patients is all of a sudden acutely ill, you're going to need some help from your teammates.
Yeah.
Whether it's helping with that patient who is now had a change in condition, or helping take care of your other patients so you can spend all your time with that patient that has a change in condition, you're going to need your teammates. And when your teammates don't know what's going on and don't know how to work together, it's going to be really hard.
Yeah, that makes sense. And I think interesting that the question just came in about it would be great to talk a little bit about the research, because I'd actually like to take us there, just because a lot of what you're sharing about some of these challenges and this idea that newly formed teams need help getting up to speed quickly is something that cultural intelligence, or CQ, can address. So I'd like to take a few minutes to talk to the audience about what is cultural intelligence and how can it impact this idea of highly functioning or highly performing teams. I'm going to take a moment to pull up my screen, and let's start by just talking about what cultural intelligence, or CQ, is. Cultural intelligence is a skill set. It's a capability to function effectively in culturally diverse situations. Now, it's important to recognize that when we say culturally diverse, we can think of culture very broadly, right? This could be defined by our ethnic background, by our gender, by our age. We know certainly that different generations approach work and life differently. This could even be a difference in functional background. The way that someone does things in this department might not be the way that we do things in another department within an institution. And cultural intelligence is a form of intelligence that breaks down into 4 distinct capabilities. This is what we call the CQ framework, or the CQ model. And these capabilities, these skills that we see over and over again that show up in people who are high performing, in teams who are high performing, starts with CQ drive. This is getting at the heart of our motivation, but it's more than just motivation. It gets at the heart of our confidence or our self-efficacy. You know, a lot of times when people are anxious, especially in a high stakes situation, they may feel not confident in how to engage either with a patient that's not like them or with a new team member who they don't really know. And so with that low level of confidence, we tend to see high levels of anxiety. Moving on to CQ knowledge, this is our general understanding that cultures do differ, right? People who come from different generational backgrounds, different ethnic backgrounds, are going to view the world and make connections differently, and we need to understand that. Moving into CQ strategy, this is getting at the heart of, do we actually plan? Are we being intentional about our interaction with people who might come from a different cultural background than we do? And then finally moving into CQ action, which is behavioral flexibility. This is the idea that I know just enough, I'm motivated and confident that I know how to adapt when I'm working in a situation that's unfamiliar to me. And what we see in this skill set is, like other skills, it's malleable. It can be changed, it can be improved. And so how does this malleable skill set really impact teams and answer some of those challenges you were talking about, Jess? This is where the research comes in. It's been almost 3 decades of research behind cultural intelligence across 160 different countries globally, and we've now assessed almost 300,000 individuals. And what we can see is that when CQ is low, team effectiveness will be low. But when CQ is high, when this skill set for engaging and relating effectively is high, we see improved team effectiveness. Why? Because what the research shows over and over and over again is that CQ can improve the outcomes you see on screen, the outcomes that tend to be challenges with these newly forming teams. We know that with high CQ, we'll make better decisions, and our processes for making decisions will be improved. We can more quickly and effectively integrate a group of people who don't know each other when our cultural intelligence is high. We can set shared values and communication norms, and it allows us to be more adaptable and less anxious because we're equipped then with a better way to see and engage with the world. And for those of you who are interested, I'm going to pull my screen down now. For those of you who are interested, Prudence put into the chat a link to the research section of our website. And this has several different articles and case studies related to cultural intelligence and the outcomes we just talked about. And if anybody's interested in diving any deeper into some of that research, we can certainly get that information to you. But it's really these ideas of integration, decision-making, and shared norms. How do we expedite it? Right? What can we do to really take advantage of what cultural intelligence can bring to a team? So with that, Jess, I want to come back to you and ask, with your experience, with the things that you've been observing, because you've been on the front lines, and more recently now you've been less focused on the front line and more focused on how do we bring quality care to our patients, right, in our processes and our policies. So can you talk to us a little bit about what it is with the CQ model, this form of intelligence that helps facilitate effective teams or helps buffer some of those challenges that teams are experiencing?
Yeah. So I think what I usually come back to and what strikes me the most about the CQ framework is your CQ drive. So that motivation, when I want to do well, when I want to know more, when I want to be able to interact with others around me well, whether it's my coworkers or patients, whoever it might be, that motivation can be such a huge foundation to help kind of carry you through. And so I love the motivation piece. And as I'm motivated, then I can work to learn more. I can increase my knowledge. And then the thing that I actually think is really poignant about this framework, it's not just that I'm getting to know these things about different cultures, but then what do I do with that knowledge? How do I take that knowledge and information and allow it to kind of help me actually be able to interact well with those around me?
Right.
When I go into a situation, go ahead.
Yeah. Well, before we move on from that piece about CQ drive and motivation, one of the things that we see often in healthcare, but also in organizations outside of healthcare, is that someone's CQ drive can actually predict burnout. Right? If we see individuals and teams with really low levels of CQ drive, then oftentimes what we see coming with that is this idea of burnout. Oh, I am not motivated. I'm not confident. It's really, really hard. And I just don't think that this is working. Right? And when we see CQ drive is high, what we notice is that there's a built up resistance to burnout because of what you're sharing. I'm curious, I'm motivated, and I've practiced just enough that I have a little bit of confidence now in my interactions. And I think that that is so relevant to what you were sharing earlier with the turnover. We can use this intelligence model to start predicting where we might have pockets of burnout in our organizations. Do you want to talk a little bit about that and maybe what you think about that?
That's an incredible point, actually.
Yeah.
Man, I I just think it's a great point. And so if we look at our teams and where they're at in that progression and even doing that assessment, or even as leaders ourselves, doing our own self-assessment, and where is my motivation? Do I feel motivated? Do my coworkers feel motivated? Do those I'm, leading, do they feel motivated?
Right.
That's powerful. Um,
And learning how to leverage that as leaders and improve it, right? Because we know it can be improved, and we know
yeah,
that drive, as an example, can be made up of several different forms of motivation. Intrinsically, maybe I just enjoy meeting and learning about people who aren't like me, or maybe I'm more motivated by the external circumstances. I know that engaging with this team will allow me to do career progression or whatever my goal might be. So as leaders, and even as team members who want to work effectively with their colleagues, you can learn to leverage that. I can say, in my own personal situation, I have times certainly where, oh, it's hard and I'm just not motivated and I don't want to do it, but I'm aware of that. And I think to some extent, that's one starting point for people in the CQ journey, is just starting to recognize, even on a day-to-day or a minute-by-minute basis, where's my CQ drive right now? How motivated am I? How much do I really know about this situation, about what's happening? How intentional am I about how I want to approach the situation? And then how flexible am I when it might not go according to plan? And so, I didn't mean to kind of cut you off on your other question, but I thought, that motivation is more than just good fuzzy feelings. It can really start to predict very important outcomes and help us address things like turnover and burnout before they become big problems for our organizations. Why don't you talk a little bit more, Jess, about the strategy and the action pieces of CQ and how you see that coming into play with, especially in terms of effective healthcare teams?
so kind of how we talked about that, as our teams seem to sometimes be in constant flux, depending
Yeah.
on the situation, it's hard to know how to interact well with each other. And
Hmm.
so the more we learn about each other quickly, whether it's
Hmm.
asking questions, just being aware that differences do exist. And we all have different cultural values and preferences. It can help us then form that strategy to be able to relate well with each other,
Hmm.
and to have good conversations and get to know each other in a faster way. And
Hmm.
then going into that action piece then is, how well can I adapt my, whether it's behavior or my speaking, my words, to ensure that whatever message I'm trying to get across is heard in the way
Hmm.
that I want it to be heard. And that's on me to kind of adjust
Sure.
my actions so that I'm being heard, and then to be able to hear what other people are trying to say to me. And just being
Yeah.
aware of what's going on in the situation can be
Yeah.
really valuable for a team.
Yeah. And, this moves us really nicely into the next question. Share with me, and by the way, I want to let the audience know we're talking about a lot of different things like cultural values or cultural intelligence, or the idea that it can be assessed. Jess talked a little bit about assessing our cultural intelligence. We are going to spend a little bit of time in a couple of questions talking about the tools that can help to facilitate what we're talking about, facilitate the expedited team cohesion. But before we go there, Jess, can you share with us, what would an effective and efficient healthcare team look like? You talked about this a little bit in your last question, this idea of starting to anticipate versus react. Can you talk to us about what does an effective healthcare team look like today, post-pandemic, with all the challenges that we're seeing?
So, and I think it can vary, situation to situation and area of healthcare
Mm-hmm.
to area. So it may look a little different depending on where someone is working. But I think that there's certainly some things that stay constant, kind of that idea that you just talked about, anticipating needs. When teams are effective, they're able to look around at each other and look around at the situation, be aware of what's going on, and being able to step in and be available and help and be present when it's needed for their other team members.
Mm-hmm.
Just the other day, actually, I was doing some leader rounding. For those, I don't know if you know what leader rounding is, but so in hospitals especially, but throughout healthcare, we like to, as leaders, go where the work's being done, ask the questions to our patients, be with our teams, just really be observations and talk with patients and see how everything's going, assess process, all of that good stuff. And so I was leader rounding on one of our units. And this particular day, we actually happened to have 3 nurses working that had been with the organization for several years. So when I was just observing, they were functioning so well as a team. And so the situation, nurse 1 was sitting at the computer about to give blood. Nurse 2 was going to help her and go with her to give blood, because we have to have 2 nurses to administer blood. And there was a phone call. So nurse 1 answered the phone call. As nurse 3 came out holding 2 drinks in her hand, about to go to a patient's room, but the phone call was for her. And so she tried to juggle these drinks while she took the phone call, and nurse 2 just got up. He walked over to her, took the drinks out of her hand, and took them to her patient's room without even asking. Just saw that there was an opportunity to help and be available, that she needed some assistance. Even though that was such a seemingly tiny little action, just when we're looking at how our teams are working well together, those are the types of things we want to see. And so I went right up to him and just gave that feedback of how valuable that action was and how important that was for, team dynamics. And that's, what do we want to see in our culture? What are the positive behaviors that we want to see? Those are the things we need to celebrate and encourage. And and using CQ with our teams, it can help us kind of come to that a little faster and understanding what our other team members might need and being aware. I think that's the big piece, is being aware, and it's so valuable.
Do you see that often? Do you see it often where teams, especially, in this case, there were teams, who had been working together for a while, but is that frequent when teams will start to anticipate each other's needs, or without asking, took the drinks, took them where they needed to go, because a lot of times when we're talking about culture or getting along, I get the question of, well, isn't it simple? Can't it just be showing respect? Well, maybe, but maybe not, because what if respect is shown differently than the way you portray it? What if that team member actually didn't want the drinks taken because she felt it very important to be the one there caring for that patient, right? And so a lot of what we're talking about today in terms of adaptability and motivation, CQ gives us a new lens to look at these things and to pause before we just do something that we think would be helpful, right? Because a lot of us have been taught, maybe not all of us, but many of us have been taught that, I want to do unto others as I'd like to have done to me. But with cultural intelligence, we actually focus a lot more on, what do you need? Not what do I need? I'm not going to treat you the way I want to be treated. I'm going to treat you the way you want to be treated. And just like you talked about that simple act of kindness, cultural intelligence can also just be a simple flip of mindset, right? It's not about me. It's about doing right by you, whether you are my patient, whether you are my team member, whether you are my leader, right? That was a really great example. Do you have, I know that when we do webinars, the audience just really loves to hear personal examples that you have. Do you have an example of a poor team outcome when something didn't go well?
I think we see those sometimes, not all the time in healthcare. I mean, that's definitely not what we want. That's not the outcome we want. We're here because we want to take care of our patients. We want them to have high quality care. So I think at the root, we have wonderful staff that want to be there, that care about being there. But sometimes maybe what I see in teams that aren't as functioning is that team members maybe get frustrated more easily or, struggle with that working together piece, where I think you made a great point that it is important to understand what your team members need, what they value, what kind of help they actually want. And, in that example that I gave, those team members, that's absolutely, she was really happy and said, oh, he's great. He's always helpful. He always sees that we have a need and he steps in and he helps us with it. But they had been working together. They knew each other.
Right.
So, yeah, when you don't know each other well, do you step on each other's toes? Often it's not intentional, just kind of how you pointed out. It's not intentional, but it still is not, it's not helpful. And so how do we get to a place that we understand each other well and know what each other needs, and we can be available and present?
And I think that moves us really nicely into the next part of our discussion. We've been talking a lot about how these challenges, really at the root of them, it's how do I get to know my team member more quickly, right? It's always been about how to get to know the other, but now we're in a situation where it's critical to expedite that process. And there are many, many tools out there available to help expedite team cohesion. And we're going to talk about a few of them that the CQ Center has and can facilitate. But just given your experience in a lot of those different backgrounds we saw, from nursing to nursing education to your higher education context, what have you come across that's been a real help to healthcare leaders, healthcare professionals, healthcare teams to expedite that process of team cohesion?
So I think anytime that you're assessing values, whether it's personality or learned values or whatever it might be, the more you can get to know your teammates and their preferences, it's incredibly helpful as you come together as a team. Even so, my quality team about a year ago, we did Enneagram. I don't know if you've heard of Enneagram, but it gives you a number, and I'm a 7. So I look for, happiness and excitement and challenge. And, but I have a team member that it was really helpful to know, because give me 5 minutes and I'm ready. But she's like, if you're going to change something, I function the best if you can give me 24 hours. I really need 24 hours if something's going to change to wrap my head around it so I can be my best. And that was really valuable information as we were, kind of forming our team still and moving into that performing stage, to know kind of her preferences and at the root who she is and what she values. We did this for all of our teammates, but that was the one that really stuck out to me the most because it was completely opposite of my natural tendency. And so the more we can kind of speed that up, how valuable it is. There's even in one of my classes, actually, I do a quick Myers-Briggs. You can do the really long version or you have your quick ones. I do a really quick Myers-Briggs with students and ask them to process through that and what that looks like in their work environment as nurses, et cetera, how that reflects and using that. And I know CQ has a tool also, which is really valuable, and I'll let you introduce that more, but there's so many tools, but just getting to the root of assessing preferences and values can really speed up that team cohesion.
Yeah. And, this just reminds me, several months ago, we held a webinar on, CQ and team effectiveness, not necessarily in the healthcare setting, but more in the private business sector. And this same idea was at the heart of the challenge. And that is, we cannot overlook the portion of forming an effective team that is the awareness piece.
Yeah.
What are the preferences of my team? What are my preferences and how do those differ? And the real value of the CQ model that I shared is it can be applied or leveraged in terms of any sort of value measurement. If I think about those 4 capabilities, it doesn't matter if you and I are talking about the Enneagram and maybe you're a 7 and I'm a 1, by the way. And so now what do I do with that though? We work really differently. We do not have the same style. So how can I think through those 4 pieces and get motivated? What do we have in common that I can use to build up my motivation to work with you? Even on the Myers-Briggs, right? Perhaps I'm very extroverted, which I tend to be, but maybe my team is introverted. Again, I can go back to the CQ model and framework, and I can say, what knowledge don't I have that I need to have about why my teammate has the preference that they do? And what can I showcase to them so they know my preference? So a foundation of understanding is so critical to expedite the team cohesion process. You're right, we do have a tool. I'm going to pull it up on screen just for a moment because we've talked about this idea of culture and values. And what you can see as this screen loads up here is that we have a tool here at the CQ Center that we use frequently when we are doing a training or a coaching engagement around something that we call cultural values. So you can see on screen here sort of 10 different value sets. You've got individualism versus collectivism, which we tend to see a lot in terms of teams who might have conflict. Why? Because maybe I prefer to take my piece of the project and go work on it and do it well, but maybe my teammates want to take a more collective approach. This is all of our project. How can we work on all of it together? Or this is all of our patient. It's not just your patient because you were the person caring for them at the time. And there's 10 different values that we can measure and we can look at to set that foundation for awareness, understanding our team. It can't stop there, right? If we do this exercise, and you can see now on the screen that when we do an exercise like this, we allow people to annotate and they start to place across the continuum, where do they sit? And the light bulb moment that goes off is, I understand now. I get it, Jess. You're low uncertainty avoidance. Risk is not something that bothers you. I'm very high uncertainty avoidance though. So I like to have plans A, B, C, and D all lined up before we move on anything, right? But it can't stop here. It can't stop by measuring our values and understanding them. It has to move beyond that into how are we intentional and strategic, right? and how are we flexible so that I don't have to become just like Jess to work with her. I just have to adapt enough to give her what she needs so that we can move forward together. I'll go ahead and pull my screen down. I know that we have a couple of questions that have come in from the audience. Before we get into those questions, Jess, do you have any sort of concluding comments that you would make to our audience today around the value of building that team foundation and really leveraging CQ to expedite the process? What would your concluding remarks be?
So I think something actually that you just said a minute ago related to the assessment piece is that it's one thing to know who I am. It's another thing to know who my teammates are. But then what do I do with that? How can I learn to kind of flex my own preferences and behaviors and actions and in a way that meets the other person's needs? And so when all of your team members are coming together with that same understanding and they're all working to flex and adapt and you know each other's preferences, it can be so powerful that you're coming together in a way that is respectful of each other's preferences without necessarily compromising your own preferences. You're just respecting the other person's. And so I think that is the piece that can be so valuable in learning to function as a team well and in a way that is really powerful for not just your outcomes in terms of how well we're taking care of patients or whatever your team's function is, but also how well are we, forming as a team and getting together and, creating that team cohesion. I think that's the key there.
Yeah. Thank you for those concluding remarks. I have some questions that I'd like to bring up. There are some questions directed specifically to you, Jess, and a couple to me. I'm going to start with one question for me, and here it is. I'll read it and then respond. Is the CQ framework important only at the working level teams, our frontline teams, or can CQ help leaders and C-suite to integrate better amongst other leaders, right, and motivating their teams? So we've been spending a lot of time talking today about teams, right? That was the focus of our webinar, but the cultural intelligence model, the framework, can be applicable and valuable to many different layers of the organization. We've talked mostly about teams and individuals working together, but if I'm talking from a leadership angle, then I can similarly say, how do I lead my team differently because I understand their needs? I can speak for myself as a leader, as an example. Every time I bring a new person onto my team, I assess their cultural values, their preferences for going about life and work. And then I, as a leader, adapt. It's on me to flex, to make sure that I give my team what they need. And beyond just the people portion of it, the CQ model can be a very, very powerful framework to build out a DEI strategy. If you think about those 4 areas, we can start by saying, as a leadership group, what is that one common mission we're all motivated to meet? What knowledge right now do we have as an organization, and what knowledge do we not have? Do we need to see what competitors are doing? Do we need to see what the community is seeing that is lacking in our organization? Then we can get into the planning portion of our strategy. What are those steps that we're going to do, right? And then what are the actions, the milestones to meet those objectives? And so CQ is a powerful tool for your people and your people development processes, but it's equally important to your strategic plans and objectives around whether it's DEI or functioning teams, it gives us a way to think about and map out a strategy. So that's how I would answer the importance of the CQ framework. It's flexible and it's applicable whether you're an individual trying to develop your own skill set or a leader looking to leverage a model that can help with some of the outcomes we've talked about. Jess, a question for you. Can you share any example of how CQ helped you in a day's work at the hospital or with your team? So maybe take yourself back to when you were working, maybe on the front lines, and maybe it's before you even explored cultural intelligence. Can you talk to us about how that showed up for you, really in a day's work?
So I think there's multiple examples of this.
Mhm.
Even now, in a day, I could interact with 50 plus people every single day just because of the nature of my role.
Right.
And so when I'm having these interactions, I may not know the person very well, or I might know them well. And
Mhm.
so I have to be able to, whether it's asking questions or being aware, being observant, and figuring out how to interact the best with this other person so that
Mhm.
we can come to that shared goal and have good outcomes. I have to be able to do that quickly because I
Yeah.
interact with so many people every single day.
Yeah.
I say,
And I
even then, as a
no,
nurse
go
on the
ahead.
floor and with patients, you have patients come in and, you're obviously meeting them for the first time. They're anxious, they're scared, nobody actually wants to be in the hospital.
Right.
And so how can I develop rapport with them quickly and
Mhm.
give them that, comfort to know that, okay, we're going to take care of you. We are going to figure things out for you, whatever it might be, but to develop that rapport with patients quickly.
Mhm.
And many of those patients have, whether it's a different cultural background than me, different cultural values. For example, in the city that I live, we have a really high deaf population because
Okay.
we have one of the best deaf high schools in the nation.
Okay.
So understanding just your city makeup, what are the different populations that exist in your city, and then being able to learn about preferences and being
Mhm.
able to flex your behavior, et cetera, to meet those needs of patients. And then
Yeah.
coworkers,
Yeah.
we have coworkers from different countries, different, et cetera. And so again, everybody has different things that they prefer. And so
Yeah.
getting to know my team members and being able to work effectively with them is really valuable.
And a question, it wasn't posed by the audience, but it's something that often comes up in this space is how does cultural intelligence differ from cultural competency, right? Just this idea that, well, if I know enough about the culture, I think I'll be okay. Uh, I'd like to take it back to the heart of what's at this challenge, which is time. It's so limited. And how can we do things quickly when it's so much change constantly? And one way that I tend to describe cultural intelligence or the cultural intelligence model is you don't have to learn everything about a particular culture or about your particular patient or even about your team. You might know very little, right? Because they're coming in and out. The CQ model can be used on the fly. I don't have to know everything about your preference. If my cultural intelligence is high, then I'm going to understand through the knowledge piece that there's a difference. I might not know exactly what it is, but I understand that something is different about how we're approaching this. And so I'm going to start flexing. And I now have this framework I can think about, which allows us to adapt and move and engage on the fly, which is probably most critical in healthcare when many things we're doing are happening on the fly, right? I have another question from the audience. Can you define Myers-Briggs? Jess talked about a lot of different tools that she's utilized to help build that foundation of understanding. Myers-Briggs type indicator is an assessment that measures an individual on whether they're introverted or extroverted, whether they're intuitive or sensing, whether they have, and I can't remember, I'm not well versed in that model like an expert would be,
It's
but
that
it's the
thinking and
Myers-Briggs type
feeling.
and
Yeah. The
thinking
other
and
two,
feeling.
thinking and feeling, and then judging and perceiving.
Yes, yep. And so that can define how we approach things differently. She also talked about the Enneagram, which is another self-assessment model that can help us understand personalities and preferences. I did share that this would be recorded and sent out to our audience. In addition, what we do when we send out the recording is we also will send some material, so that for those people who are interested in saying, well, I want to learn more about the tools that are out there to build this foundation quickly, we'll make sure that we put information in there about the cultural values that I showed, the mapping exercise, about some of the other tools that we've talked about today. And one thing I want to make sure that we don't forget to talk about is tools are one piece, right? We also have to practice. We have to practice leveraging those tools, practice thinking about cultural intelligence. You can't just do an assessment and be more flexible. It doesn't really work that way, right? Another question that was asked, and I think this one's an interesting one. It's, there are so many competent and willing people coming from overseas that want to work in our healthcare settings. Maybe this is the contract labor that you were talking about, Jess, but this particular audience member says he feels a lot of resistance to this type of workforce and wants to know, why is that? Or maybe said in another way, how can we get people, right? Jess, you're already motivated. You already have this sort of passion to do this, but maybe not everybody's going to start with that same level of motivation. How can we get people to understand what's in it for them to try to flex and try to understand one another? And how can that come back to this idea of resistance towards the other, what I might say? Can you talk about that?
Yeah. So, I think it's always a natural tendency as humans. We struggle with things that are different.
Mm-hmm.
So how do we get past that? And that is where that motivation comes in. And so kind of that, change management strategies 101 is understanding people's motivation.
Mm-hmm.
So how can we bring this back to what is in it for me?
Mm-hmm.
It's a start, but what is that selfish reason that we can find for individuals to help them understand why this is important?
Yep.
And once we get those balls rolling, we can push it further and further and further to where now they have the motivation all on their own. They see the why. How can we help individuals see the why of the importance of this question and this problem?
Mm-hmm. Mm-hmm.
That's what we need to get to.
Yeah, I couldn't agree more. It's CQ drive that's at the heart of not only resistance to burnout, like we talked about earlier, but it's also at the heart of what is it? What is in it for me? Right. And one tool that we've touched on, but maybe haven't talked about explicitly, is the cultural intelligence assessment. Right? I talked about how can CQ be relevant for leaders. It can be thought of as a strategic framework, but also leaders can assess the cultural intelligence of their individual employees and of their teams. And that gives us data, right? You can manage what you measure. Right? Have you heard about that before? You can manage what you measure. And so if I'm able to measure an individual or even a collective level of motivation, I can start to do something about it. I can start to see, is the motivation mostly caused by a lack of internal or external motivators, or is it being driven by a lack of self-confidence? the strategies I deploy might be different depending on what that assessment shows me. And the importance not only of measuring preferences, but also then measuring those skills that CQ is really critical for leaders who want to make sure that they are building intentionally the culture that they want to have. You know, we only have a few more minutes left in today's session. I want to know if, you know, if you have any other questions, please put them through. There's one other question that I see that I'd like to take, and then we'll probably wrap up with some next steps, okay? So how is CQ relevant to domestic and also global diversity? We even have audience members on this webinar today who are dealing with healthcare either here in the States or perhaps outside of the States, in the UK, in Europe, where their health systems, their policies, their practices are very, very different. So Jess, can you talk to us a little bit about how CQ can be relevant, whether you're talking about a global team, a global organization, or even how we're talking about CQ in terms of our domestic differences, the differences in our own communities? Can you speak to that?
Yeah, so I think we've touched on this briefly, but in understanding that we all have preferences, we all come from different backgrounds, whether it's just where we grew up. It could be, I grew up on the west side, you grew up on the east side, and we have different ideas of different things or different preferences. So even domestically, understanding that we are all bringing to the table a different background and a different set of beliefs and ideas and preferences. And then just expanding that and understanding that obviously different countries are going to maybe have larger differences and preferences. And so understanding that we are all bringing those to the table and being able to ask the questions and be willing to have the conversations and adapt in those situations to be able to relate to each other. I don't think it matters where you're at. The CQ skills are incredibly relevant because it can help you adapt no matter where you're at, whether it's in your own town or in a different country.
Yep. And that's the heart of what we're talking about, right?
Yeah.
Allowing us to adapt on the fly. So with that, I will go ahead and wrap our session for today. Thank you, audience, for your really good questions here at the end for Jess and I to answer. We really hope that you enjoyed this session today and that you've been able to take away some ideas about how cultural intelligence could be utilized in your institution, in your organization, and how you can look at tools to expedite this process. One last question was just sent through, and I'll try to get it in our last minute here. Can your programs be customized to specific challenges such as HR, and can they be offered to both large and small organizations? The short answer is yes. We have a variety of topics and programs that we cover, from healthcare to teams, to educators, to leaders. When we're doing a session within an organization, we always tailor make the examples and the scenarios to the challenges that that unique organization is facing. And we have several different ways that we can engage with organizations, both large and small, from self-paced online learning modules to certifications and train the trainers to equip people inside of an organization to scale cultural intelligence. So thank you for that question. I appreciate it. Jess, thank you for taking time to be with us today. Your time is limited and it's valuable, and we really appreciate the experiences that you were able to share with us today. I hope everybody has a great rest of their day, whatever time it may be for you, and we hope to see you soon.